So welcome to Exam 1 Review. I am Professor Bogart. I teach both of the RN and the PN courses, and I'm also lead of both the RN and PN. My goal here is to have you all succeed, and hopefully I am going to explain things in a manner that you understand. Now, if I am saying something you don't understand it completely, please do not be afraid to stop me. I do not get upset. I don't get offended. I don't get even, any of that stuff. I appreciate questions because if you don't know, how are you going to answer a question if you don't get the concept? Okay. All right, let's go ahead and let's go to our PowerPoint. So yes, there are a lot of chapters that we're going over. So sometimes, it is like overwhelming to look at. If you look at it, 1, 2, 3, 4, 5, 6, 7, and this week we're just going over chapter 22. So it's a lot of stuff that we are going over. So, okay, in your book, you have all in the beginning of chapters, you have all of these definitions. So let's go over them, okay? Cephalocotic means first you lift your head and then you go to walking. Cephalic is a head, okay? And then it goes to caudal, which means you walk. That's the first year of life, cephalocotic, caudal. Proximal distal means you start with everything here and understanding, and then you start working to the distance. Proximal means here, distal means away. And that's just the way a baby is learning, okay? General Pacific means now you're starting to do things that maybe you have a rattle and all of a sudden it shakes and now it makes a noise. Well, now you're really having a lot of fun with that, okay? So now you've learned that. Maturation is the way a person grows and develops, and it does being affected by where you come from, your inheritance, your mom, your dad, your family. Family completely helps you with that maturation and that growth. Now, growth is the way you grow, height, weight. And in pediatrics, we do height and weight on every single visit, whether they are in a urgent care, a doctor's office, it really doesn't matter. So growth is important. And as we go on, you're going to understand why we do that, because if they're too little, too much, we need to make early interventions. Now, development. This is how the body grows. As for instance, the first year of life, you lift your head, you turn from the front, the abdomen to the back, then the back to the abdomen, then you get on your knees, you crawl, then you get up and sit up by 8 months, right? And then you stand up by 9 months and you creep. And then by 12 months, you should be able to take maybe a step by yourself. Some kids are running, but by the book, you should be at least standing up and trying to walk, okay? Development. Now, hereditary is part of that develops your maturation, right? Where you came from. It does be involved in how you mature, for sure. Now, there are different sort of families. The one where mom and dad have children, they stay together forever, that is called nuclear. That means mom and dad and the children are all from the same mother and father. The extended family would be somebody like me, Nana, grandma, right? It's also your aunts, your uncles, your cousins. All of those are extended. And we know that all of that pays a really good the child's really influenced a lot by that. I know my grandson is, and he's 6.5, and I've helped raise him since birth. Blended, that means like me and my husband, I have 2 children. My husband has 3 children. Together, we have 5. We are blended. So we grew them together. And alternative means what would they say is a communal family. I mean, you'll see that a lot, I think, that I've seen in my career. Like there are a lot of immigrants that come to South Florida where I live in Homestead, and there's lots of farmland down here, and they get together and they're like the alternative. They live together as groups, whether they're Mexican or South American or wherever they're from. They are communal and they all take care of each other. Okay. Exclusion reflex. You take food when you feed a baby about 4 to 6 months, usually about 6 months, and we start a little bit of that baby food, right? Usually rice cereal first. And you put it on their tongue and they go, bleh. And you think, oh my God, the baby don't like the food. It is not that. They don't know how to work food in their mouth. So they stick their tongue out and they try to push it out. But it's called an exclusion reflex. They will learn eventually how to put it in there and how to take it down. But initially, extrusion reflex, okay? Grasp. Well, we know there's fine motor skills, which has a lot to do with fingers, right? So first thing is a reflex grasp, where mommy puts their little finger next to the baby, and the baby just by reflex will take and give it a hug, okay? Then it goes to voluntary. I want that rattle, and they take it. And then it's going to go to the pincer grasp, which is first crude. Then it's going to be really fine. And then it goes forward into the fine motor skills of taking things in and out of a box, in a container, and then building a block of two. That's all fine motor skills in the first year. Now, apprehension is the ability to grasp objects between finger and the opposing thumb. That's called prehension, or it's also called a pincer grasp, okay? Now, a parachute reflex is take a kid, turn him upside down on the crib, and his hands and legs will come out. It's because they're protecting themselves. They think they're going to land, okay? And if a baby is going to fall, usually it's like about 8 months. You'll see them stick their arms and legs out because they've got control of their motor now, right? So parachute, hands and feet come out because they're protecting themselves. Negativism. Oh, this is your typical toddler. Toddlers are no, 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 me, mine, mine, mine. Okay. And that's just absolute part of what they say. Most toddlers, you ask them to do something. No, no. Okay. Absolutely perfect. Now, going along with toddlers, ritualism. Ritualism is keeping children on a routine, and specifically toddlers need that. Toddlers like that because it gives them a sense of feeling of security, okay? That means they know when they wake up what's going to happen, when their naps are, when they're going to eat, when they're going to play, when they go to bed, how they go to bed, when bath time. Ritualism, so important. And as nurses, we get them into the hospital to take care of them. We need to know their schedule so that we can work with it. It'll be a happier baby, and you want that happier toddler, ages 1 to 3. Now, personality is defined as the unique organization of characteristics that determine the individual's typical or reoccurring patterns of behavior. This is just the way they act. Are they happy? Are they sad? Are they aggressive? Are they the one that just want to hug? They're all different personalities for many, many different reasons. Now, again, like toddlers love parallel play. What is parallel play? Well, think of a parallel, two lines that don't meet, they don't touch. It's kids playing here and here, and they're not playing with each other. They're playing their own thing by themselves. And this is toddlers, right? Me, mine, mine, mine. They don't share. So toddlers are parallel play, okay? And that egocentrism, think about ego, me, mine, all about mine, and I'm not sharing. And this is absolutely, again, toddlers. So toddlers are no, no, no. I want some organization. I play parallel, not with anybody. And I want me first. It's all about me, okay? Now, Freud. There are different levels of Freud, and I think the ones that we talk about a lot is, the oral. How do infants look at the world? How do they explore? How do they decrease stress? All in their mouth. All in their mouth. That's why we give them the pacifier, or they find their thumb or their finger, whatever it is, because that's how they self-soothe. Now, anal is that toddler age where they're potty training. They're starting to understand about what's coming out of their butt, right? So that's part of potty training. Now, phallic stage is not about their penis. What it is, it's about little boys love mommies and little girls love daddies. And it's just because that's what Freud says, but it's really what it is. I mean, to the day my father died, I was daddy's little girl, and he had 6 sons. So it is part of that stage. Now, latency. We're getting into the school age now. And school age says people who play together are usually same-sex peers. You usually have a girl, they're going to play with girls, and boys play with boys. And that's what latency, what Freud says. And then they get to adolescence, and of course, hormones and puberty and whatnot. Now they are attracted to opposite sex for many different reasons. So Freud's stage of morality explores the mouth world through their mouth, right? That's the pacifier. That's the fingers. That's toys, blankets, anything in the mouth, right? We know toddlers all about no, 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 me, mine. And it's trying to teach them how to share. It's very difficult. And then that phallic is that preschooler becoming aware of themselves, who they are, what they can do. Again, this is, part of preschoolers, and it goes forward. Now, latency is now school age. Now, school age is all about same-sex peers, okay? And how they work together. Now, there are about 7 or 8 different theorist questions on this exam, okay? So these are important things. Now, Piaget is all about thinking and discovering and then working and building that discovery to make it work more. For instance, when we have the sensory motor at 0 to 2, this is when they realize that even though they can't see a toy, they saw it before and it has to be here somewhere. That's object permanence. Whether you put it in the toy box, whether it's underneath a blanket, they go exploring. They know it's going to be there, okay? Now, also, they also can take a rattle and they'll hold it, like I've said earlier, and all of a sudden they shake it and there's a noise and they go, wow, I like that. And then where does the toy go? In the mouth. Okay, it's all about sensory motor and thinking, cognitive thinking. Now, pre-operational, these are those children who have like a broom and they ride it like a horsey, or they put their arms out and they ride it like an airplane. They're starting to give names to inanimate objects. It's like, why do trees have leaves? It's because the leaves will hide them when they want to hide. So these are things and the way these children think. Now, as they get to older, again, now they're thinking and putting things together, and of course, part of it's magical and imagination. But as they get more up to that concrete operational, this is school age. This is where they understand the differences in things. They understand that if you have a tall glass with water in it and a short glass, if you pour the tall glass into the short glass, even though it looks like maybe it's more in the tall than the short, it's the same amount of liquid. So they're starting to think more here. They're starting to be able to understand those things, even though they look different, they really aren't. And then formal operations. As I talk to, another thing about concrete operational and thinking, let's say a kid gets sick. And it's because he went swimming and didn't bring a towel and it was raining and he got cold. So I got sick because I didn't have a towel and it was cold and I got chilled. Again, that's starting to think why I got sick. Again, this is cognition. Now, that formal operations is all about children to be able to think. And they're able to think and come up with stuff that talk about adolescent. they want to get something done, this strategy, okay? They're told they can't go out this weekend to their friend's house because whether it is they did something wrong in the house or talked back or whatever. And then that child with formal operations and thinking, they're going to plan and try to make it possible. They're going to get an A on the exam. They're going to put their clothes away, make the bed. They're going to take the garbage out, help with dishes, do all these things. And mom says, all right, you've been really good this week. Okay, you can go out. Okay, that is manipulating and that is strategy. So sensory and motor, I've already given you a lot of these things on the formal operations, as I said. So all of these things is I've just discussed. Now, Erikson. Remember infants, all they know is to coo, cry, sleep, eat, and go to bathroom, right? They don't know much more than that. And of course, they are starting a little bit with their hands and feeling, but that infant is all about, I cry because I want mommy, daddy, or caregiver, and they come. And that is trust. They trust, they know it's going to happen. Now, there are infants due to many situations that don't get that. Whether it is a bad environment of family or, drug abuse, alcohol abuse, or just plain old abuse, that is mistrust. And that child's not going to cry. And that kid sort of gets a hopeless look. And you sort of, if you work with infants, these younger children, you'll see that. Now, as they get older, you get into the toddlers. And these kids are me, mine, me, do, right? They're autonomous, which means I want to do it. Autonomy. I want to go and figure things out, right? What do toddlers do? They explore the world. And how do they explore the world? Well, they get on top of couches. They want to jump from this couch to the other couch. And they do things that could hurt themselves, right? Well, the autonomy, they don't know they're going to hurt themselves. The shame and doubt is mom, dad, grandma, aunt, uncle, whoever saying, oh, be careful, don't do that. You're going to hurt yourself. Don't get down from there. So even though they wanted to do that, somebody's telling them no. And that's the shame and doubt. As we get a little bit older, 3 to 5-year-olds don't want to help. They're going to help put their, shoes by where they should be and their clothes in their dirty hamper or whatever. But they're also afraid they're going to do it wrong. And that's the guilt. School age, probably one of the most tested questions, is all about industry versus inferiority. Remember, school age, you're starting to think more. They're starting to understand more, according to Piaget, right? Starting to be able to see things. And what you would do for these children. And let's say you have a child who's a school age child and they are in the hospital and you want to give them something to do to pass the time. Now, you're not going to give them a puzzle that's 1,000 pieces because you're going to fail. Now, industry says they do something, they do it well. So give them a 100-piece puzzle so that they can accomplish it. It's going to take a little time, but that's my industry. I feel good. I did it. That's playing sports and doing well. That is taking a spelling test and getting 100. That's my industry. I do it really well. I feel good about it. Now, inferiority is when they can't. For instance, some kids are good at school. Some are horrible, at gym or PE. So the kid who would have the industry was a kid who's good at gym and running around in sports, whatever. And the inferiority would be, now that kid who's good at gym is probably not good at schoolwork. Well, the schoolwork is their inferiority. So that's the difference. Industry, a task you do well. And then when you get up to adolescence, remember, adolescents are growing, they're maturing, they're becoming young adults, and it's all about, who am I? What am I going to be when I grow up? do I like the band group? Do I like the artsy group? Do I like the sports group? Or I want to hang out with the gang group? I mean, that's their identity. It's all about body image and identifying who they are. It also could be sexual. Do I like girls? Do I like boys? Do I like both? Do I like none? What do I like, right? And that confusion is, I really don't know what I should do. I don't know what I want. So identity versus confusion. And the rest are just older ones that we don't go into. Again, infants, trust versus mistrust. When they are happy, this is a healthy personality. Now, toddlers, you need to let them do things like self-feeding. A toddler should be able to feed themselves by the end of the second year. They should be able to spoon and fork and be able to do it. They should be able to start dressing, right? Autonomous. Don't do it for them. Let them try, even if it's inside out and backwards. Preschoolers, I've done that one, give examples. And then school age children, again, what can I do well? And those many people say, wow, I don't believe you got 100 on that spelling test. I didn't know that word. How did you know what that one was? And you feel good because you did well. And again, the adolescence is all about self-esteem. It's all about figuring out who they're going to be. And of course, peers are extremely important. Now, Maslow's hierarchy of needs, it starts out with what you need to live. And then after that, it's, other things you need, like an umbrella to go out in the rain. It also goes on safety, that all of, safety, you're in a car seat, that you have a strap on if you're young on a roller table, that you're not getting a knife to a 3-year-old. And then loving belonging, it's all about the hugging and kissing that mom and dad and Nana does, right? And esteem. What do I do well and what do they praise me for? So different levels of Maslow, and you're going to see examples on the exam about Maslow. So Maslow, the physiologic needs. What do I need? I need a heart rate. I need vital signs that are good. I need my height, my weight. That's all those sort of things. Now, Kohlberg is all about morality. Morality is doing right and knowing if you do wrong, that there's punishment for doing right and a punishment for doing wrong, okay? Now, infancy, they don't understand anything about what they need to do. They just know they need to eat and they're going to cry, all right? Or I need my diaper changed. That has nothing to do with infancy. Now, preschoolers, what they're doing is they want to get the reward for doing good. They want whatever it is that it benefits themselves the most. Like you get a lollipop if you do this. Now, as they get to be a school age, Kohlberg is more about pleasing others and not get in trouble by the law for doing bad things, okay? And then, the teens are, again, they're understanding the whole spectrum of how to behave in school, how to behave on the outside, what to do, what not to do. They know right, know wrong. Doesn't mean they're going to follow it because it depends on what group they're in, but that's what Kohlberg says there. So the infant, well, the first 4 weeks of life, they're called a neonate, okay? Neonatal ICU, that's how you can remember it. Neonate is the first 4 weeks. After that, up to 1 year, they're called an infant. So there is a difference in names there. So be aware as you're reading questions, if it says neonate, that's the first 4 weeks, and infant is up to 1 year. Now, infants double their weight by 6 months and triple by the end of first year. Born at 7 pounds, 6 months, you're 14 pounds. By the end of the first year, you're going to be 21 pounds. And the other thing is, can you imagine the first 6 months of life, they are growing 1 inch, which is quite a bit of growing. if you can imagine. I'm just totally mind boggled how much that these children grow in the first year of life. They triple their birth weight, and they at least 6 inches they've grown, quite a bit. Now, the first year, we know by the end of the first year, they should be taking, they say, some independent steps. Now, it doesn't mean one step and fall. Some kids are running, some kids are walking, some kids are barely walking, but at least they're standing up, attempting, and that's what they want to see. Okay? My kids never walked till they were 15 months old. Even my newest grandson, he never walked until 15 months old, but then he ran. He never walked, okay? Teeth should start about 6 to 7 months, and 1 tooth per month up to about a year, and then it gets, even more will come in. Now, the first 6 months of life, a parent has a choice. Are they going to breastfeed, or are they going to give them iron fortified formula? That is the only thing that they should be eating. Not whole milk, not skim milk. It's either breast milk or iron fortified formula for the first 1 year of life. After 1 year of life, they can get whole milk. They need that fat, okay? So it wouldn't be a skim milk. Now, at 6 months, they're drinking a lot of milk by now, and if they're breastfeeding, it's a lot of, pumping or nursing that mother's doing. So we start feeding foods then, because now their intestines is ready to tolerate it. Before that, it's too immature. And what do? Well, we start with one food at a time, and usually we start with rice cereal. And why? It is most hypoallergenic. It's easily tolerated. So rice cereal they'd start with, and then it's every 4 to 7 days. Then you will change it to a new food once there's no reaction. Reaction could be diaper rash, vomiting, diarrhea, and could be rashes anywhere on the whole body. That is those things that you'll be looking for. Now, sometimes parents want to cook their own food for their babies and give it to them. I have what I call a daughter. It's just been my daughter's friend since the age of 4. She has a baby, and he's just about 18 months old now. And she's decided she's going to cook, and she's going to do all this stuff to feed her baby. She doesn't want any of the jar prepared stuff. So what do? Well, there's ways that you should prepare it. Remember, babies don't really have a good sense of taste yet. So you're not going to put any salt, sugar, no honey before age 1. And even then they say, you shouldn't. When you're cooking the food, it should be in as little water as possible, because the volume has no calories. So they want the food to take up the volume. Because remember, it's only 1 tablespoon of food they need, even into toddlerhood, of the food group that they're getting. Now, once it's cooked, you're going to take and strain it, puree it, and then if you put it in an ice tray, you can put it in the freezer. And what's good about that, you take one little lump out for food, thaw it out, and that baby can have that for their eating. So don't add anything to it, minimal water, and put it in an ice cube tray. And then you could take one little lump out, and that could be their food. So I says that sense of trust, it makes a healthy personality. And we know that children should be stimulated. That's why we have the rattle. That's why we have mobiles. That's why we have tummy time, that they can look at things and stuff. Really, really important that they have that. Thought, abilities, of course, this is cognitive learning, and of course, it's Piaget. Now, sometimes you have a very lethargic infant, and this lethargic infant turns off, shuts down with loud talking, bright lights, quick movements. So how would you take care of a lethargic infant? One that's just not as active as another. Well, number 1, avoid bright lights. Do not move that kid quickly, slow and easy. Speak softly, gently, and have that kid sitting up and just quiet. And that kid tolerates that better, okay? And there are children like that, infants. Now, sudden infant death syndrome. Remember, these children should be placed what we call back to sleep on their backs, only on a firm mattress. And the only time they're turned over is, again, that tummy time during playtime while they're wide awake. And then they're exploring and looking for that object permanence. Where is that thing I saw? I know it's here somewhere, and they're trying to shuffle to get there. That's why tummy time's so good. Car seat. It shouldn't be, I know that many parents say, well, my kid's cranky. I go out, I'll take him a ride in the car and he goes to sleep. And then I'm just going to sit there and let him sleep. It's not something that's recommended, to tell you the truth. But every parent's done it. I've done it when my kids were little, but it's not recommended, okay? Car seats should be rear facing until a kid weighs 22 pounds and especially less than age 1. And this is something that's new and in your book. They should be in the center of the car, not on the right or left side. Most parents put it on the passenger side in the back so they can turn around and can see it, right? It's not recommended anymore. You put it in the center, okay? And make sure that they have a really secure car seat belt on so it holds them into place. Now, many parents have that, and I think it's great, that sling carrier. Just make sure there's been some incidences where they've smothered. Make sure their face is up so they can breathe. Now, toddlers. Toddlers are different. These kids don't eat much. Remember, they're into everything. They want rituals. They parallel play. It's me, mine. It's all what they are, okay? Now, as this kid is getting to toddlers, we're going to be introducing more and more food, right? But the one thing we will never compromise on is to decrease the fat in their diet. They need it for central nervous system development, for growth and development, okay? By 2.5 years old, their birth weight has quadrupled. So born at 7 pounds, they should be at least 28 pounds, okay? They're getting more and more able to use their hands, to be able to walk, to move. Their depth perception, eye control, all of those things are becoming better and better. Whereas infants are eating every 3 to 4 hours a bottle or something, by toddler, you can give them breakfast, lunch, and dinner, and maybe snacks in between. So they become more and more like a normal person who eats, right? Complete bowel and bladder control is usually achieved somewhere between 2.5 to 3 years old. It doesn't mean all children are done by 3 years old. Remember, all children are different. And remember, Erikson talks about being autonomous, going out, exploring the world by themselves. And they, again, going to have somebody tell them, hey, be careful, don't do that. And that is something they have to know, because they're going to feel shame. They're going to have doubt. Can I do that? I shouldn't have done that. What's going on? I want to do it. Me, mine. Now, toddlers start to learn more and more words and understand more, but don't be, fooled here. You're going to see very young children understand more than you could ever imagine. I've always just sat there and talked to even babies, and they do understand. So with that, knowing that they start about 1 year old with maybe 1-word sentences. Those sentences are going to build up and they're going to be able to speak more. Doesn't mean it's accurate. It's not always understandable, but they're trying more and more. Toddlers are going to try to do toilet training. And again, they're going to be trying to speak more. And they're going to be, blocks, building 5-6 towers. They're able to, run around more. And that's just part of the toddlers. Now, separation anxiety. This is where you have a child who needs to go into the hospital. And in the hospital, mom has to leave. There's another kid. There is, work. There's things they have to do. So sometimes they've got to leave. This is why you as a nurse needs to know what sort of routine these kids are on to try to help. But what happens in this separation anxiety, there's different stages. Initially, what does an infant do, this toddler, ages 1 to 3, when mommy has to go? They're going to scream and yell, right? They are going to go bonkers, like they want mommy. And then, of course, the nurse has to go in and try to calm them down. Like, do they like a pacifier? Do they like a special toy? Do they like a special blanket? Making sure to try to calm them. Then they sort of like, sit there, they'll, regress, maybe start sucking their finger where they haven't done that. And then detachment. Mommy comes and they want nothing to do with her because now they're angry and they're like, all right, she hasn't been here. So, all right, I'm just going to play with my toys and not pay attention. And that's what happens there. One of the things with these children is, that no, those temper tantrums, is to try to get them under control. Temper tantrums. Ever have a little 3-year-old in a grocery store lay down on the floor and cry and kick their legs because they wanted something and you're like, no, we can't get that? Well, what should you do? Well, the best thing is to walk away, ignore them, unless it's something that they could get hurt. If they're not being hurt by it, walk away. And something, that kid might try it another time or two. But if you're not paying attention, you're like, okay, this don't work. I'm just wasting energy, and they won't do it. Another thing is, having older or younger brothers and sisters. Very thing that there's this rivalry. You love him more than you love me. You love her more than you love me. It's part of what they do. Again, timeouts are for you to describe, why is that kid on timeout? It is not a punishment. It's just to sit down and think why that was wrong, why you bit your brother, right? You bit your brother, so you're going on timeout. You're gonna, when you stop crying, I'll start the clock. And it's 1 minute per year of age. Now, preschoolers. Preschoolers are now getting ready to go to school, preschool and then kindergarten to follow, right? They're able to pee and poop, hopefully, in the right place. They're able to accept less rituals of like the toddlers, and they're able to go away and be separated, and they can talk and tell you what's going on, and their attention spans have increased. Preschoolers are ages 3 to 6, and their gross and fine motor skills are getting more and more developed and less clumsy and awkward. They can run, they can skip, they can draw pictures, they can stay in the lines as they get older. And again, they're starting to think a lot more, and their language, they're able to express themselves. As I said with Erikson, it talks about initiative. That means helping mommy, or seeing another kid or your mommy don't feel well, giving them a hug. That's being initiative. That's something that's not taught. It's something that they sort of know. And Kohlberg is basically the moral development. And moral development is always doing the right thing. And it's very similar to what I just said about Kohlberg. But again, they're starting to realize, like, well, I've got 3 trucks. Let me give a truck to somebody else. It's the right thing to do. Okay, keeping all 3 is wrong. It's selfish. Again, they have really complicated sentences. They're understood more by the end of the preschooler. Play, 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 play. They are cooperative with other kids. This is more cooperative play, which means they play together and there's a goal in the end, whether it's playing with Legos, making a house, that's a goal in the end. And they're imaginative. They're talking about a truck and it's rolling down the couch and over onto the coffee table and through the mountains and the rivers and around a tree. It's all about, they're talking out loud. And this is all about, preschoolers. They're extremely magical thinking at this. One of the things is, you have to set some limits. Again, they're jealous. My daddy loves my mommy more than he loves me. It's part of the jealousy, so you have to stop it. Thumb sucking, hopefully, will be done before they go to school, because those are when the permanent teeth come in at age 6, right? So hopefully it'll stop. And again, they have explored themselves. They're, playing with themselves. And the one thing that said is just, if they're doing it out in public, say, could you go to your room and do it by yourself? I don't need to be watching that. And again, bedwetting and your recess. Now, sometimes a kid always is urinating, at night. And you've done everything you can, decreased fluids, and it's just part of the kid. And that's primary. Secondary is, now the kid's been dry and something happens. Well, think about things that could happen. Well, urinary tract infection could cause them to wet the bed at night. Diabetes mellitus, diabetes insipidus, those are things that they would urinate, part of the symptoms of the disease. So that needs to be checked out. Now, school-age children, they are becoming more and more independent, and they are starting to do things and do things well. And the stage of industry is those things they do well. We know that Piaget talks about, like I said, those concrete operations, understanding why they got sick, because they were out in the cold or their hair was wet and they didn't dry it, or whatever the thing is, or understanding that you rip a paper up in 16 pieces, it's still the same size paper. They're starting to get that. Their growth is slow. Their weight gain is slow, but right at puberty is when they're gonna, start having those growth spurts. School is extremely important on the social lives of children. They're learning about other people, other cultures, thinking about other people and being accepted into a group, whether it's a soccer group or Little League or Girl Scouts, whatever it is, they need to be accepted in these groups. They do get these positive feelings about themselves when they can do what they need to do, as in self-pleasers, right? Their language is, again, still growing. They're learning more words, being able to express themselves well. This is all about same-sex friends, okay? And it only becomes opposite sex in the adolescence, which is puberty, okay? Same sex during school age. School age children tend to learn these crazy words like teletransport is one of the words that my grandson uses. And he doesn't understand what it means, but he says, that can teletransport. And I'm like, what does that mean? And he's like, it teletransports. Okay, they're experimenting these things. Remember, again, moral Kohlberg, they do what's right. They want to do that. They want to please, and they don't do, sometimes other friends are doing things they shouldn't do. Children with conventional morality won't do it because they don't want to be punished for doing something wrong, okay? Team sports, physical education are all part of those activities they need because it's part of their esteem. It gives them self-confidence. I kicked a goal, okay? I was able to do a handstand or whatever it is. That is Maslow's, and that's all about esteem. So how do you address a child who is struggling with focus and attention? Well, if you have a kid who can't pay attention or focus, Number one, can they see and can they hear? Maybe they can't hear, right? Maybe their vision isn't good. So these are things that need to be looked at. Many times, those children are sent to the school nurse from the teacher. Something's wrong. Something's happening here, and this would be something that you would discuss with the parents. So adolescence is when they start those secondary sex characteristics. We know in girls, it's breast buds, and boys, it's the enlargements of the testicles. And this is that age where they're going to grow, 25% of their body at this time. Now, Erikson is already talking about sense of identity because at this age, they're not stuck at home all the time, right? They're out with their friends and at school. And it's really important for them to fit in somewhere, okay? They used to fit in with the family. Well, now where are they going to fit in? They're figuring out what I'm going to do when I grow up. It's about who I want to be intimate with, boys, girls, what group do I want to fit in with? It's all about that. And as I said, Freud is all about genital stage, which is opposite sex friends, okay? As I said, Piaget is that formal operations, and they call it abstract reasoning. Remember, this is where they can get what they want because they can figure out what they have to do to please mom to be able to go to the mall on Saturday or to go to a friend's house or to get the $20 for that new game or whatever. This is their logically thinking. And it's not just one way. They keep, amending it because, oh, mom likes that. Let me do this. And they do. They can manipulate the situation. Again, physical development, they are by the end of puberty, they are ready to have children, right? They've got breasts, they've got curves, all of the fat deposits are in the right place. It's just part of that all through, the adolescent stage. So body image is huge, right? We know that keeping open communications with adolescents is really important. And many times, let's say we're teaching these children about sex education, making sure you have a private place. And remember, you can do this without parents in the room talking to them. Say a girl comes in with having multiple urinary tract infections and you get the parents out and you say, so why do you think you're getting these urinary tract infections? It could be that they're experimenting with sex, right? So, and you can't be judgmental. Let them talk about whatever they're going to say. And I'll tell you, in my career, I've been shocked a few times with what adolescent says, but do not let that be known by that adolescent. Just take a moment and ask another question. And then what is the number one hazard that kills adolescents? Motor vehicles. Remember, motor vehicles are young to old, accidents, unintentional accidents are the younger kids, but adolescents is motor vehicles. So how to assess and educate? Well, we know ADPI, right? We know that you have to assess, you have to plan. Once you plan, let's do an implementation and evaluate, okay? So knowing how to make you gather all the information, right? So then what do you need to do? Well, you need to make a diagnosis and you need to start planning that. Now, Denver 2, this is a misunderstood test. It does not look at an intelligence. No, what it does, it evaluates their personal, social, fine motor language, and gross motor abilities, which is growth and development, right? And if the score is low, they can implement early intervention, speech, physical therapy, occupational therapy. Again, timeouts, 1 minute per year. And, we do milligrams, micrograms per kilograms for calculating dosages, but the most accurate is actually the BSA, okay? it is most accurate. And again, how do you teach sex education adolescents? Just what I said. Make it private, don't let them talk what they want, and don't, be condescending and tell them, your opinions. Just let them talk and then just give them the information they need. So remember, medications must be adapted for their body surface areas, right? Their BSA, and to make sure that they're getting a dose that's not going to damage them. Absorption, distribution, metabolism, excretion. Remember, body systems in children are immature, as in the young and the old. You were taught in pharmacology about that. They're both, have to be looked at. Be really careful. And we know children, I mean, some of them react even in very small doses. So be aware that children do, and the reactions are very unpredictable. Weight measurements are always kilograms, because we're given milligrams, micrograms per kilograms. IM on a child is going to be the vastus lataris, and an IM injection, some people think you could give that in their deltoid. It hurts, many of those IM injections. So put it in the ventrogluteal, please. And IV fluids. Well, years ago, we didn't have all these IV pumps like we used to, but thank God we have them today. Because if you give too much fluid, let's say you have a 500 ml bag hanging and there's no IV pump, and that whole thing runs into a child who's 1 year old, you could put them into congestive heart failure. So be very, very, very careful. And any infant, younger children in general, make sure that we're doing that I and O sheet accurately, because we can see if too much has gone in and prevent it before it happens. Pacifiers remember, are a self-soother. Infants sometimes need to go to surgery or have conditions that they can't eat from. Make sure that developmentally they get a pacifier. Self-soother, it calms them down, okay? And then how do we measure output on an infant? We're not going to have a Foley catheter in them. They're too small, okay? So we're going to be measuring diapers. So a number 1 diaper weighs 30 grams. And if you take it off the infant after it's soiled and put it on a scale and it's 60 grams, it's going to be 30 grams difference, which is 30 mLs of urine. Very easy, very simple. So always know that you need milligrams per kilogram. You're going to see one of the questions is going to be by that. You're also going to see 2 desire, or what you have times the quantity questions, and you're going to have 2 IV mLs per hour questions on this exam, okay? Now, why should tetracyclines be avoided in the first 8 years of life? And this happened back in the 50s. It's one of the first antibiotics. It grays their teeth permanently. It sort of eats the calcium, and their teeth will be gray forever. And what's the leading cause of death in children? Injuries, right? Any sort of injuries. And then a latchkey child. These are kids that come home from school, nobody's there, they have a key, they've been told, go in, lock the door, do your homework, get a snack, and stay in the house. Now, there's a lot of risks with this. They could burn themselves, or they could injure themselves. There's an increased risk of injuries on latchkey kids because nobody's telling them what to do, right? So that is all I got for exam 1. Anything else you need, again, you can visit me, send a message. I would be glad to go over with you. Now, who is iPhone so I can give you credit? Sir, iPhone, your head is down. Who are you?
Soriba. It's Soriba.
Ariba?
Soriba Kamara.
Oh, that's him again? All right.
Yeah.
Thank you.
Soriba, stop it.
Boy, we keep meeting up, don't we? Not a problem. I just want you to get credit for it. All right, guys. It's been a pleasure. If you need anything, let me know. I'll be posting these as soon as I can, as soon as I get it. All right. Thank
Okay,
you for
thank you.
coming. Was this a
Mhm.
good time for everybody?
Yes.
Sure.
Yes.
Mhm.
All right. So we'll do it 2 o'clock on Mondays for the reviews. Not a problem.
Okay.
Thank you,
Thank you.
guys. Have a good week and good luck on the exams. Let me know how you do.
Thank you.
Thank you. Bye-bye.